Hey guys, thanks so much for tuning into my channel. My name is Kaya. I am a registered nurse. I currently work in radiology and I've been getting a lot of questions on what I do as a radiology nurse, what my role is, how I get the position, how is it different from interventional radiology and traditional bedside. So today I am breaking it all down for you. So if you're interested in learning more about this specialty, then stay tuned. So a little bit of background about me. I am a registered nurse. I've been a registered nurse since 2020. When I got out of nursing school, I immediately got a job doing like COVID testing, COVID vaccines. Eventually I moved into emergency nursing and then eventually going on to do some travel nursing contracts throughout the pandemic. I had a baby back in 2023, so I stopped working in the emergency department and was on a little hiatus from the workforce for about 7 months. So after that, when I was looking for positions, I found radiology nursing and I got right into it. So let's get into the main question. What is a radiology registered nurse? Because when you're in nursing school, you don't hear about radiology. You only hear about like med surg, ED, you hear about ICU, things like that. You never hear about nurses working in radiology. So a radiology nurse specifically works in the radiology department. It could be of a hospital or it could even be an outpatient clinic. I specifically work in the role of a radiology registered nurse inside of the hospital. There are interventional radiology nurses, which is different from the role that I do, but also works in the radiology department of the hospital or interventional radiology department of the hospital. My role, I work in CAT scans and MRIs. All right, so let's talk about a day in the life. Let me walk you through a typical shift for me. So I work from 8 to 4. So I'll get into work in the morning around like 7:50, 7:55. And at 8 a.m. is our first outpatient of the day. I call the patients the day before just to remind them of their scan, to give them any instruction, and prepare them for what to expect for the CAT scan, or as far as MRI, or MRI techs usually take care of it. They really want to get a thorough history of these patients, but I can also take on that task as well. So in the morning time when I come in, I start doing the code card checks in our department. I also check the fridges. Well, it's just a warmer, so we check our tower warmer and get everything together. We can load contrast up if we have a patient coming up, and I just log on and see what's going on so far, because we'll walk in and we'll have patients who have scans from upstairs inside the hospital, inpatient. We'll have scans ED, and then we might have an outpatient who came a little early. We have an outpatient scheduled from 8 to 5:30, 8 to 5, but only have outpatients with contrast from 8 to 3, so that a nurse is always there when a patient is having contrast. So my morning looks like that, prepping patients for their scans. So if they come in at 8 o'clock and they have a CAT scan of the abdomen and pelvis, if it's for like kidney stones, we don't need any contrast with it. So they'll just go right in. I'll let the tech know I'm grabbing the outpatient. We review the script and then we get them on the table, scan them, and they're finished. However, if it is a CAT scan of the abdomen and pelvis that requires oral contrast, I'll administer the oral contrast. If they need IV contrast, I'm going over the patient's history. Have they ever had an allergic reaction to contrast? Do they have any history of kidney disease? What medications are they on? And I review that the day before and also the day of, because people have had allergic reactions to iodine contrast, which is what the CAT scan eye is made out of. That being said, I'll place an IV and we scan them, but we do a wide variety, not just abdomen pelvis CAT scans. We'll do a head, we'll do a shoulder, we'll do a neck, we'll do angiograms. We also have patients who come from the floor and patients who come from the ED, and we do trauma studies, which is like head, C-spine, chest, abdomen, pelvis, like we're scanning the whole body. We may do like a cystogram. We may do a scan that requires rectal contrast. Throughout my day, I'm just getting in contact with the nurse and I'm trying to figure out that patient's history. I'm also looking in the chart at their history. Have they ever had CAT scans before? Have they ever had CAT scan dye? What are their allergies? Do they have kidney disease? What's their kidney function like? All that stuff. Are they pregnant? So that's pretty much what I do in that realm. I'm making sure that these patients don't have a reaction on the table, okay? And then when it comes to MRI, it's a little more lax because we have outpatients throughout the day for MRI, and it's mainly just putting in IVs. There's nothing more I can really do but monitor the patients and call patients and things like that for MRI, because our techs are literally like the front runners in MRI. A lot of these scans that they do, like cardiac scans, they may take an hour. So I'm just sitting there pretty much waiting and monitoring the patient during the time, especially if they're on a monitor, like on a cardiac monitor, on oxygen monitoring. If they have any drips, if they're from the floor, then I'll monitor them. But otherwise, I'm just usually putting in an IV and removing an IV. During procedures, I will assist the CAT scan techs or MRI techs with getting the patient on the table, I'll hook them up to contrast. I'll administer the contrast via power injector for CAT scans. If there's a delay between the time that they're getting contrast and they're getting a scan, then I'm just letting them know, this is what to expect when you get the contrast. How's IV line feeling? Because I'm going to make sure that it's not infiltrated. I want to make sure it's actually going through their vessels so we can get a scan and we don't have to over radiate them. That's pretty much it. I'll administer the medications. I'll assist the techs. We'll do timeouts. And then post the procedure, post the exam, I'll just educate the patients that they need to drink more water, stay hydrated, just so they can flush all the contrast out their body. So at my hospital, I focus on MRIs and CAT scans, like I said, but there are some hospitals where radiology registered nurses, they'll assist in fluoroscopies, they have IR procedures where they assist with like PICC lines, things like that, placing in like suprapubic catheters. There's like a range of different things you can do in radiology nurse. So obviously it's less bedside nursing and it's very hands-on. So you pretty much set these patients up for a procedure, you hook them up for contrast, you watch these techs like set them up and like scout the images that they want to take and they scan them. It's just like learning a different aspect of healthcare. That's what I love about it. You don't have to sit there and give medications all day and keep on reassessing patients. And not that I didn't love that as a nurse in the emergency department, but it's just a big change, especially when you have a lot going on in your life. Like I have a kid, I'm in school, like I'm doing a lot. So I just needed that flexibility. And that's another thing about it. I love the flexibility of it. I work 8-hour shifts instead of 12-hour shifts. So I just love that aspect of it. And then also working with a variety of patients, learning more about the anatomy of the body and looking at different cases. Like you see pulmonary embolisms on these scans. You'll see like a 12-centimeter cyst. I just love the aspect of looking at something new. So one question that I keep getting is, do you need experience to work in radiology? So in my department, all of the nurses who are there, we all have emergency room experience. I know you do need to have at least a year of experience to go into like IR. As far as my role, I feel like you can do it as a new grad. However, this will depend on the facility because it depends on the variety of cases, the acuity of the patients that you're getting. So I would say at least a year of experience, at least in med surg or emergency department, just in some type of unit. It could even be ICU, but you do need experience. Is it stressful compared to floor nursing? Very laxed. You have your days where it's very busy. You have, your patients who are a little difficult, things like that, but it's not as stressful, in my opinion, as working on the floor or in the emergency department. And then how does it compare to other specialties? So I will say, as far as in my hospital, they pay us by our experience. They don't pay us by the department we work in. So that's a plus. So if you're working in the radiology, you're getting paid the same as an OR nurse or an ICU nurse. So pay wise, we're on the same level if you have the same amount of experience. As far as skills and medication administration, you do assess patients. You do need to watch for contrast reactions and things like that. But you're not like, and you do have to critically think, obviously, because if something happens, you need to know what to do next. So you are using those skills, but not as much as you would on the floor. And especially if you work in an outpatient setting, you really will only be using like your assessment skills, therapeutic communication, and then IVs, because we do IVs every second of the day. If you're interested in radiology nursing, I really hope this video helped answer some of your questions. And if you have any other questions, feel free to leave it in the comments. Don't forget to like this video, subscribe to my channel, and thanks so much for watching. Bye.